Hi, I'm James Gladstone. I'm Chief of Sports Medicine at Mount Sinai Health System. I'm also one of the U.S. Open orthopedic consultants and the team physician for the U.S. Davis Cup team. I'm really happy and excited to be here. Tomorrow, the finals of the Western and Southern Open, and then we kick into the U.S. Open.
I'm Dr. Alexis Colvin. I'm an orthopedic surgeon at Mount Sinai. I'm also the Chief Medical Officer for the US Open, and really excited to be here this year. So when someone has a hip injury, they can actually feel it in a number of places. They can feel it in the front of the hip, so almost in the groin area. Sometimes they'll feel it on the side, and then they can also feel it in the back of the hip as well. And the injury can be as severe as causing someone to limp, or it could be less severe and they feel it only when they do a certain activity and not really with rest or things that are lower impact.
Yeah, so the most typical ones are what we call overuse injuries, the tendonitis type of injuries, and at the shoulder level, you get it a biceps tendonitis, a rotator cuff tendonitis, sometimes tenderness over your AC joint, which is where the collarbone meets the shoulder bone, and at the knee, it's most typically what we call colloquially jumper's knee or patella tendonitis, right where the kneecap tendon meets the bottom part of the kneecap. It's typically doing any kind of repetitive activity, so things like playing tennis, running, not as often bicycling. Usually it's involved with impact loading or it can be with swimming in the shoulders as well, especially during the summer months.
So shoulder, hip, and knee injuries can happen with sports activities, but they can really happen with day-to-day activities as well. So you don't necessarily need to be playing a sport to have this type of injury. And we definitely see it with everyday things such as yard work or housework, and slipping and falling. Any of those things can cause similar damage to the muscles and the tendons and the bones.
Yeah, I think that's a great point to make because we both see a lot of meniscal injuries, and that's a very typical injury in the knee level. And the meniscus is the shock absorber between the two big bones in the knee. And that can happen either traumatically, someone slips and twists their knee, someone's playing soccer or basketball and lands badly. The other way, it's a degenerative process. And unfortunately for people over 40, you start getting little degenerative tears in the meniscus, which I like to call micro tears. And if enough of them add up in a specific area of the meniscus, you can get sort of connect the dot type of problem where the meniscus tears seemingly without any significant activity or accident.
I think the other important thing to remember too is everyone is an athlete at some level. So we are treating professional athletes at this tournament, but we are also treating day-to-day athletes in our offices. And so while the goals of the people here are to make it to the finals of this tournament, your goal may be able to run a 5K or simply be able to walk around the city comfortably. So any of those things are problems that we are dealing with in the office.
And I think just as importantly is we treat everyone the same. What we learn treating professional athletes helps us actually treat amateur athletes and weekend warriors a lot better.
Yes, I agree 100%. We really take the lessons that we learn and are able to be on the cutting edge of our techniques by being involved with professional athletes, and then take this back to the office to treat our patients in our own practices.
And I think because of the requirements of treating professional athletes, like Alexis said, we really have to stay on top of our game. So that means we're always reading journals, we're participating in meetings, we're lecturing at conferences, and always hearing the latest things that are coming up and figuring out what works and what doesn't work.
Well, there's a number of different treatments kind of depending on how severe the problem is. So for most things, surgery is the last resort, but there are certain tears where there is no option other than surgery. So if we're looking at things that are not surgery, they can range anywhere from physical therapy to different bracing to changing around the activities, taking a period of relative rest from an activity that's bothering it. So when we're in the office, we really take the whole picture in terms of not just what we see on the MRI or the X-ray, but also what that particular person is feeling and what their goals are in terms of what they want to get back to doing.
I think anybody who gets injured, the first thing they want to do is stop the activity they're doing, rest the injured body part, perhaps ice it, maybe take some anti-inflammatories. If it's excruciatingly painful, then don't wait around. If it's annoying, I would give it a few days before you run to the doctor. But certainly after 3 or 4 days, if you're still feeling the same pain and the same intensity of pain and it's not getting any better, then it's definitely worth seeing the doctor.
And I would also add that if it's something that you're worried about, come in. We're always available, and we're more than willing to help diagnose and treat whatever the problem is, no matter how severe it is. So the safety practices that we put in place start as soon as you make your phone call for the appointment. So patients are spaced out with appointments to allow enough time so that there's not a lot of people waiting in the waiting area. And then once you actually set foot at the hospital, your temperature gets checked. There's alcohol sanitizers everywhere. There's ambassadors that limit the number of people that go onto the elevator. And then once you're in the office, all the physicians, of course, are wearing PPE. And you, as a patient, are given a surgical mask before you even come up the elevators.